Now let's just return to our top story this morning. NHS paramedics telling Sky News they fear they are failing patients as the pressures of the winter months strain NHS services. Well, we're joined by paramedic and spokesperson for the College of Paramedics, Martin Berry.
Morning.
Good to see you. Look, there is no doubt that we all have to take our hats off to the work that paramedics do. It must be incredibly stressful. The fact now that some paramedics are turning around saying we feel like we are failing people is awful.
These people that have entered into these professions and healthcare want to help people, and there's nothing more heartbreaking or frustrating when you feel that there are things in the way, their systems are not set up correctly for us to be able to provide the care that we need. And what we're seeing is we're all used to the idea of the paramedic being ready to respond to anyone with an acute medical emergency, but what we don't tend to think about is actually increasingly ambulance services and A&Es are now being used to support the rest of the healthcare system, and other areas are looking to A&Es and ambulance services to help them out when they're most in need too.
So is it simply an injection of cash in other areas of the NHS that would fully support you?
It'd be very easy for me to see it as more money will solve the problem, and of course more money is always appreciated, but I think we need to look differently about how we use the systems that are in place. So for example, the 111 system manages a lot of patients. However, over the winter months especially, when they're busy and they may not have access to the GPs, they're sending more and more patients to the ambulance service for paramedics to respond to. They may need to be assessed, but that's holding up ambulances and paramedics that should be used elsewhere. So it's about thinking about how we can better use healthcare professionals and maybe not necessarily following traditional models, such as the very doctor-led systems that we have in place.
I mean, are we talking about almost an on-call triage system?
We are indeed. So it's about correctly sending the right person to the right place. So, for example, there's some really excellent examples of new ways of thinking where paramedics are working in the call centres in 111 because of their experience, really understanding what that patient needs. It may not need an ambulance at their doorstep, but they may need healthcare elsewhere in the system. Or even paramedics and physiotherapists working GP surgeries and preventing these people from actually having to go to the hospital in the first place.
How much of a difference would it make if we all consider what we're doing a bit more? I mean, every year we get the recordings of phone calls for things that are done which are just completely and utterly bonkers. How much of a strain actually do the public put on the service by not using it properly?
We're very fortunate that we have an absolutely amazing healthcare system which we all benefit from. And of course, we always ask the general public to think wisely about how best to use this system, which is there to support them, and make use of other services as well. So think about the pharmacy down your road, who excellent knowledge and exceptionally well-trained individuals who can support you. And maybe when you go down to the surgery, if you're offered a nurse practitioner appointment or even a paramedic practitioner appointment, consider that as an option because it's far more value for money, and actually the level of care you receive is exemplary. So do think about that.
I have to say, I've been getting that the last few times, so you can't see a GP, but you can see a paramedic.
Yes,
and it's worked very well. You just have to go and get someone else to sign the prescription. But what's that all about? I don't understand why that's happening.
Again, it's an example of some new ways of thinking. So we're seeing paramedics with years of experience out on the front line answering 999 calls are getting to the end of their acute care professional time, but they've got this wealth of knowledge. They go on to extra training, become prescribers and are working in primary care. So they bring that wealth of knowledge and that ability to spot the really sick patients, but actually manage these patients in primary care. And our GP colleagues are seeing the benefit of this, and more importantly, patients are seeing the benefit of this.
Mm. So not just about injection of cash, as you say, reorganisation and rethinking of the whole system.
Absolutely.
Thank you very much for coming in this morning to speak to us. Thank you, Martin.
OK. Time for a quick check-up. Oh, excuse me.
Oh, you really have got a cough.
I think I need to see you.
Maybe in a bit.
Let's get a check on the weather with Kirsty.